Welcome to section 20.7 of Metabolism. In this video, we'll focus on memorizing the details of folate. Let's get started. This scene will take place in the forest with a lot of foliage. Notice all of the trees and vines that are growing vigorously on the sides of the image. The foliage here will be our symbol for folate. So foliage for folate. Some of the foliage we've chosen in this scene has a separate meaning. Notice the twisting vines that are going back and forth in a shape that resembles a double helix. This is to help you remember that folate is important for the synthesis of DNA and RNA. So vines twisting for DNA and RNA synthesis. We've added this Dalmatian with a spot on its belly that looks like a liver to help you remember that there is a small reserve pool of folate that's stored in the liver. So Dalmatian with liver spot for stored in liver. The dog is enjoying the warmth of this fire and eyeing those yummy looking leaves. The 4 leaves that are getting cooked here is to help you remember that folate is found in green leafy vegetables. So cooked green leaves for found in green leafy vegetables. The fact that there are 4 leaves and that they are being cooked on this square stone should help you remember the number 4. The 4 leaves on the stone represent tetrahydrofolate. For step 1, you should know that folate is converted to tetrahydrofolate. So 4 leaves on a square stone for tetrahydrofolate. If you look closely above the fire, you can see that there is some black soot floating in the air. Black soot and ash contain organic carbon waste, so this should help you remember carbon. In the image, this alludes to the idea that tetrahydrofolate is a coenzyme associated with carbon transfer and methylation reactions. So black carbon soot in the air for carbon transfer and methylation reactions. As you can obviously tell from the image, it appears to be nighttime, so we'll add a nice red blood-looking moon in the background. This represents megaloblastic anemia. It's shaped kind of like a red blood cell, it's red like a red blood cell, and it's very large, just like what happens to red blood cells in megaloblastic anemia. So blood moon for megaloblastic anemia. If you look closely, you can see that there are prominent craters in this blood moon that look kind of like hypersegmented nuclei. So in a folate deficiency, you will see megaloblastic anemia and hypersegmented neutrophils. Okay, it's time to add some people to the image and spice up the story. This scene is actually occurring in a planet inhabited by an ancient Homo sapien-looking civilization. This Homo sapien guy is tasting the leaves, as you can tell by his tongue that's coming out of his mouth. His tongue is here to help you remember that a folate deficiency can result in glossitis, which is inflammation of the tongue. So tongue for glossitis. The fact that he's a Homo sapien appearing guy should help you remember the compound homocysteine. In a folate deficiency, levels of homocysteine are elevated. In a second, we'll add several more Homo sapien looking people, and the fact that there will be many Homo sapiens in this image should help you remember that homocysteine is elevated. So Homo sapien for elevated levels of homocysteine. Unlike a vitamin B12 deficiency, methylmalonic acid levels are normal, so we haven't included anything about mixed martial arts in this image. When you watch the video on vitamin B12, you'll understand what I'm talking about. So this is why a folate deficiency will not result in neurological symptoms. We've also added this Homo sapien guy here with a big jug of alcohol, filling up Molotov cocktails as he prepares for battle. The big jug here should help you remember that folate is absorbed in the jejunum. So jug for jejunum. This pregnant woman is the leader of the tribe, and she's sounding an alarm with her tube pipe instrument. The fact that she's pregnant represents that a folate deficiency can occur in pregnant women. Her tube pipe instrument represents that if a pregnant woman doesn't receive enough folate, then the fetus can develop neural tube defects. This is why folate supplementation is recommended for women who intend to become pregnant, as well as throughout early pregnancy. So tube pipe instrument for neural tube defects. These 2 Homo sapien people have taken one of the Molotov cocktails and are getting ready to light it on fire as they get ready for battle. The Molotov cocktail is here to help you remember that a folate deficiency is more common in alcoholics than the general population. So Molotov cocktail for alcoholics. The guy with the match here is getting ready to light the cocktail on fire. The heads of matches contain sulfur, so this will be our symbol for sulfonamide drugs. For step 1, you should know that a folate deficiency can be caused by many drugs, including sulfonamides. So sulfur match for sulfonamides. Okay, now let's see who these Homo sapiens are fighting. It appears that there is a more advanced civilization that has invaded their land. Notice this guy in the blue, which has more traditional looking clothing. He appears to be in a fierce fencing fight with this other Homo sapien guy. These 2 fencing is our symbol for phenytoin. Just like sulfonamides, phenytoin can cause a folate deficiency. So fencing for phenytoin. This little tribe may be in trouble. Looks like there is a spaceship and several other Space Trek soldiers getting ready for a fight. The Space Trek warriors should help you remember that methotrexate can cause a folate deficiency. So Trek for methotrexate. And with that, you should have everything you need to memorize about folate.